not alone. 34 million people worldwide are suffering from HIV. Of those, 69% reside in sub-Saharan Africa. Nearly 3.3 million people infected with HIV are under the age of 15, and 1 of 5 people who are infected do not even know.
What is HIV?
HIV is a retrovirus that targets T cells, resulting in a compromised immune system. There are 2 strains, HIV-1, the more common form, and HIV-2, which is more prevalent in western sub-Saharan Africa. The infecting virus particle binds to CD4 receptors on the host T cell membrane. The virus injects its single-stranded RNA into the host cytoplasm, where it is then transcribed from RNA to DNA by reverse transcriptase. The DNA is then translocated into the nucleus, where it is integrated into the host cell genome. From there, its genes are transcribed and produce more virion, which then bud off and are able to infect other T cells.
My life hasn't been easy. I'm a drug addict. Heroin. I try to be safe. Use clean needles when I have them. If not, sterilize them with some alcohol. Flame. Boiling them. Tricks to the trade. One weekend we're all passing around the same needle. I was a little worried. Buddy John says it'd be okay. He had this top-notch alcohol that he was using. So then I start developing some flu-like symptoms. Just the norm. Headache, fatigue, muscle aches. I did get some lymph node swelling. All the expected. But after 2.5, 3 weeks, symptoms went away. Guessing I just got a flu. I'm not worried. Not worried.
My husband and I have been trying to have a baby for about a year now. I started having morning sickness about 4 weeks ago, so I went to the doctor, had a urine test and a blood test just to be sure. The doctor came back with good news and bad news. The good news was I was pregnant. The bad news was I have been living with HIV for about 6 years now without knowing. The doctor said that people can have HIV for 8 to 10 years without any symptoms after the initial symptoms. So apparently the flu I had for 2 weeks in college was the initial symptoms of HIV. So the promiscuous, unprotected sex in college now has a risk of my baby getting HIV when I give birth. I will have to have a C-section. I cannot breastfeed because HIV can be contracted through breast milk to the baby. I have to be on antiviral medications the last few months of my pregnancy to reduce the risk. My baby will have to be treated for 4 weeks after birth with antiviral medications. It is good to know that I cannot pass the virus through the placenta during pregnancy, and about 6,000 to 7,000 women each year have HIV and still have birth. So I'm not alone.
I thought I couldn't get STDs if we only had anal sex, and I knew you couldn't get pregnant, so I was like, why use a condom? But apparently you can still get STDs, and now I'm in the 3rd stage of HIV, which is full-blown AIDS, and I have pneumonia, hepatitis, and I'm tired all the time.
How do you test for HIV?
The only sure way to diagnose HIV is through a blood test that looks for HIV antibodies. The average person develops these antibodies within 25 days. However, tests only detect these antibodies 3 months after exposure. In addition, people are encouraged to repeat testing after 6 months. Testing can be done both confidentially and anonymously at a public health clinic or doctor's office. Home kits are also available. A small blood or saliva sample is required for testing. ELISA and Western blot tests may be used in combination to detect for these antibodies.
What do my test results mean?
Not surprisingly, early testing makes a difference in the patient's long-term outcome. A positive test result is no longer the death sentence it used to be years ago. However, people who do test positive have an ethical responsibility to inform all previous partners and encourage them to get tested as well. Sister, what did you want to talk about?
Carmen, I got back the results from Planned Parenthood and I'm HIV positive and we had unprotected sex last night. I think you should be tested.
Unfortunately, there is no current cure for HIV, but treatment options are available to manage the symptoms and complications that arise with the disease. The decision to start treatment considers a person's medical history, length of infection, T-cell count, and current health. Due to the constantly mutating nature of the virus, many strains exist, and targeting is difficult due to the various resistances of each strain. Fortunately, there is hope. HIV researchers are currently discovering new drugs that target the virus at different points of the HIV replication cycle.
But doctor, what can I do to prevent infection from HIV?
Abstinence is the only surefire way to avoid the sexual transmission of HIV. But sexually active individuals should always employ safe sex practices like the use of condoms, dams, and the general limiting of partners to reduce their risk. Those who participate in recreational drug use should always use clean needles.
Please don't use drugs.
Boiling and alcohol are not guaranteed to sterilize the needles.
This message has been brought to you by Sony Flash Drives.
525,600 minutes, 525,000 moments, oh dear. 525,600 minutes. How do you measure a year? In daylights, in sunsets, in midnight.